Doctor, if we have a condition, we've talked about a number of them, is it safe to assume that it's related to a deficiency, or how do we know exactly?
Well, this is where my wife and I have spent the 25 years of our marriage. We've been married a quarter of a century, and I just love her to pieces. And she's a medical doctor. She actually taught microsurgery at Harvard, at Texas Medical Center, University of California. She's internationally known as a microsurgeon, very famous. So she and I have spent the 25 years of our married life not only in love with each other, but also in love with people. And we've written 14 books to teach people how to protect themselves, how to do their own physicals for $3.79. All the numbers in there, how to read the numbers from their medical reports so they can do a better job and not have to depend on a doctor's maybe self-centered advice. The doctor is giving you advice based on his income needs. He's not going to let his house be foreclosed upon, okay? And so instead of using you as an ATM machine, you take care of yourself by reading these books, coming to my free lectures, using our suggestions for the Mighty 90, the 90 essential nutrients, and you can prevent as many as 900 different diseases, with the exception of most birth defects like cleft palate, heart defects. Those are surgical cases, but things like muscular dystrophy and cystic fibrosis, these are biochemical defects which are reversible with supplementation after the baby's born. And so these are things we're teaching people how to do. She and I have spent the 25 years of our marriage running around the world, literally, 58 countries, giving these free lectures. We do interviews like the one we're doing with yourself, and we're very grateful that you're helping us spread this message. And our goal is to devote ourselves as a married couple as well as individuals to train an army of people to take care of themselves, take care of the people they love, take care of their neighbors, and stay away from the medical system as much as they can. Obviously, you get run over by a truck, you got to go to an emergency room. If there's any place that the medical system shines, it's in the emergency room. They can do wondrous things. They can save people from some of the most terrible traumas. It's just amazing. And this comes from our experience in the military, right? This ability to deal with trauma comes from our experience in the military. And so this is where, if any place, the medical system should be used. When it comes to treating diabetes, we can make everybody's town diabetes-free in 2 weeks. We've known how to prevent and cure type 2 diabetes in the animal industry for 60 years. And as I've employed this knowledge in my human patients, we get people off of their medication to go back to normal life in anywhere from 2 to 6 weeks, sometimes as fast as 2 days. Now, when you do this with thousands and thousands and thousands of people every day, Scott, through the internet and through my associates around the world, you cannot say it's a fluke. It was just one person out of about 10 million. No, no, no. We're talking about everybody. If you're a type 2 diabetic, we can get you off your medication. If there's any, again, one piece of advice that we give to people is check us out and say, okay, this Wallach sounds pretty crazy, just like they say. He must be sniffing something. If it were true, as you'd say, the mainstream healthcare industry should be all over this. In our heart of hearts, we'd like to believe that they're altruistic and they're out there trying to help people, and they have a nice living, which would be righteous if they were doing good things. But unfortunately, that's not the case. Their primary goal is not to make people healthy. In fact, Harvard Medical School did a study on first-year medical students after they'd been accepted. They did an anonymous survey. Why did you apply for medical school? 85% said because I want the lifestyle and the credibility and the view of the community of, being a wonderful person by being a doctor. By contrast, when they went to nurses who had gotten into nursing school, the first-year nursing students, when they asked them, why did you go into nursing? They say, because we wanted to help people. Okay, and so go to a nurse practitioner, don't go to a medical doctor. Go to a naturopathic physician, don't go to a medical doctor.